Hi, good evening, everyone, and welcome to the COVID-19 Community Town Hall, which is presented by UP Health System Portage. I'm Steve Elmer, a college professor here at Michigan Tech and a member of the Health Research Institute. I'll be joined here in a few minutes by my colleague and co-host, Dr. Kelly Kam. I want to welcome all of our viewers that are joining us tonight through the Zoom webinar and social media on Facebook Live, all of the listeners tuning in on 97.7 The Wolf here in Houghton and 99.1 WIKB down in Iron River. It's great to have you with us. Our sponsors for tonight include UP Health System Portage, the Upper Peninsula Power Company, Aspirus, the MTech Smart Zone, the Iron Area Health Foundation through Aspirus, and the Physiological Society. We greatly appreciate the support of our sponsors for helping make this series possible. Tonight's town hall is our 15th in our series since we started back in September. Our topic tonight will focus on health disparities. The Health Research Institute organizes the town hall series here, and their mission is to support health-focused research for our scientists and engineers on campus, education for our students, and outreach for our rural Upper Peninsula community. We also appreciate their support for providing this town hall platform. The goal of each town hall is to better inform the community, specifically to increase awareness about all things COVID-19, how it impacts your health, the health of your neighbors, family, friends, and our community and society at large. We want to remind folks that if you happen to miss any of our previous town halls, they are public, they're free, they're available on our website. You can check those out at any time. That website is mtu.edu/health-research. Once you're on the page, be sure to click on Town Hall. You can pull up all of our town halls, as I mentioned. For example, last month, we focused on the COVID-19 pandemic and how it's impacting our mental, physical health, and well-being. Also want to remind everybody that if you miss any part of tonight's town hall or encourage others that might not be able to tune in, we are re-airing this on the broadcast on ABC 10 at 12 p.m. Eastern this Sunday. A couple of helpful resources as we answer questions tonight. We'll have a panel of experts here providing information. We just want to share these with our viewers and highlight a couple of these for our listeners tonight. We encourage everybody, especially with the information coming out on vaccines, to check their local health department website, whether you're here in the Western Upper Peninsula, if you're in the Iron County, Dickinson area, or Marquette County, be sure to go to your local health department. In addition, you can find information through UP Health Systems, Aspirus, Upper Great Lakes Family Health Center, and of course, the state of Michigan and our CDC website as well. Next, I want to welcome in my colleague and co-host, Kelly Kam. She is an epidemiologist by training. She's leading the contact tracing efforts, and we've been working together on this for quite some time. So Kelly, great to have you back with us. Looking forward to the town hall tonight on health disparities. Can you give us a little preview of who's here tonight and what's coming up?
Sure, I'm glad to be back. We have three community members and Michigan Tech members here with us tonight. Starting off, we have Wayne Gersey, who's our new Vice President for Diversity and Inclusion at Michigan Tech. Dr. Gersey's been here a relatively short time here, so we're excited to have him here and speaking about all the different ways that COVID is affecting as leading to disparities in health in a variety of different groups here at Michigan Tech and within our communities. We have Angela Hoffman Cooper, who's an educator at Michigan Tech and our Pavlis Honors College, and the Executive Director for the Association for the Assessment of Learning in Higher Education. I believe I got that all correct. Excuse me if I messed up a little bit on that. And Angela is going to be speaking to us about the disparities and how this is affecting the youth, and particularly our youth within the foster care system. And then finally, we have Kathy Cass-Ayton, if I did that wrong, who's the Executive Director of Little Brothers, which is an organization within our local community, actually over in Hancock, that works to serve the elderly in our population. And she's going to be speaking about all of us are experiencing this social isolation, but it's really affecting a lot of our elderly population. She's going to be speaking about how this is affecting our elderly individuals, which is a large part of our population here in the Upper Peninsula.
Well, thanks, Kelly, for the overview. We did have a health disparities town hall back in December. Can you remind us maybe what was covered then and how tonight will expand upon that from December?
Sure. So as we know that we definitely have seen racial disparities in COVID-19 in the differences, the really unfair differences in health of both infections, deaths, and hospitalizations that we've seen across different racial groups within our population. And we discussed some of that last time, I can't remember exactly when we did that last semester, as well as how some of the impacts were affecting particular groups within our populations, such as K-12 and some of our college students. So we're going to expand on that, touch on some of those same topics and expand on them, as well as bring in some of our new areas, because disparities hit many, many different groups.
Okay, great. Thank you, Kelly. To help us kick off our town hall tonight on health disparities, I want to turn it over to our Vice President for Diversity and Inclusion, Wayne Gersey. Wayne, great to have you with us here tonight. Oh. Wayne, we're just doing an audio check here. If you can go ahead and unmute yourself on the Zoom webinar. Perfect. And we'll just welcome you and have you provide some opening remarks again to help us kick off the health disparities topic tonight.
Good evening, everyone, and I want to thank you, Steve, and the Health Research Institute for including me in this series of town halls addressing the important topics related to COVID. Tonight, I hope with my fellow panelists, we will be able to broadly address disparities and the impact and the response to the virus. I think we would be remiss if I didn't open up with this question: what is a disparity? According to Merriam-Webster, a disparity is a noticeable and usually significant difference or dissimilarity. As used commonly today, we typically associate a disparity with inequality. We are here this evening to discuss health disparities, but we need to bear in mind that disparities are intersectional. The systemic inequities that the aged, disabled, poor, people of color, and others face have a broad impact. Therefore, it's very understandable, even expected, that these impacts and response to COVID-19 would also display inequities. And I'll stop there.
Well, thank you, Wayne, for helping us get things started. I'm going to turn it back over to Kelly, who's going to provide just a brief public health update. Again, our town halls are monthly. We were here at the end of February. A lot has happened again over the past 4 weeks, Kelly. So what do our community members need to know, and where do they need to go to find out the latest COVID-19 information?
Sure. So we have some mixed news for tonight. I'm going to start with the good news and then a little bit of not so good news. But one of the biggest news that we've had is since we've had our last town hall, we have a third COVID-19 vaccine that's been approved for emergency use by the FDA. And that is what many of you have heard of as the Johnson & Johnson or the Janssen one-shot vaccination. So that is approved for use. And like I said, that's only one shot. So it makes it especially useful in populations where it's difficult to get out and get that second shot, as well as populations where we need maximal protection very quickly. So someone going into a nursing home, for example, we want to get them as protected as possible right away. So this one shot is going to be very helpful in that. Some of the other good news that we have is that at this point, estimates are about 70% of those who are 65 and older across the United States have had at least one shot, so they are at least partially protected. However, as we're going to discuss tonight, that's not equal across the different populations. So the disparities that are there among who within that over 65-year-old group are really critical to make sure that we're addressing that. Here in Michigan, it's a little bit lower. We're at about 65%. And about overall, about 18% of those, or I'm sorry, 33% of those 18 and older are vaccinated, have at least their first shot. The other wonderful good news for those of you who live in Michigan is that starting on April 5th, sorry, I have April 6th, but on April 5th, everyone who is 16 years and older is eligible to get in line for the vaccination. So I would encourage everybody on April 5th, start signing up, sign up at your local health department with your healthcare provider, or in some areas, some other providers such as pharmacies are having vaccine available. So get in line, and when it's your turn, get your shot. Now on to some of the not so good news. Cases across the United States have leveled off. They're not going down as fast as we would like or continuing to go down. And in Michigan, they're actually rising. So we need to continue to stay vigilant. I know everyone's tired of it, but we need to stay vigilant. All the precautions we've been talking about since a year ago: wash your hands, watch your distance, wear your mask. And when it is your turn, get your vaccination. And then also make sure to take care of your own health, all the things we've talked about, your physical activity, your nutrition, everything you can do to support your own mental health and well-being, as well as your physical health and well-being. um, and um, and keep track of everything. So as we said before, that we're going to talk about disparities, and these are some of our groups that have greater obstacles to reaching their full potential. In many cases, this is because they have historically been discriminated against or excluded from political power, from decision making, and from access to all of the things that we need to have our full health potential. And so we're going to address some of these. And not only are there racial groups, but there are many other groups that we'll be talking about, including age, geography, or other social characteristics.
Great, Kelly, as always, we appreciate the public health updates. I wanted to begin just with a quick starter question before we bring back in Wayne Gersey. The president announced today a new goal of 200 million vaccine doses in the first 100 days. That's double what the initial goal was. What will this mean for things coming up over the summer and getting closer to that herd immunity that we're hearing so much about?
So we're in a bit of a race against time right now. These variants that are coming out are more infectious than what we have seen. So we have to hurry up and get people vaccinated. So the speed at which we're vaccinating is doing great to help kind of offset this risk of being of this more transmissible variant that are out there. We don't really truly understand what the level of herd immunity needs to be. Is it 60%? Is it 80% of the population needs to be vaccinated to protect us as a population? We have to remember everybody 16 and under at this point is not eligible for a vaccination. So as there's a large chunk of our population that simply isn't eligible. So we still need to continue to keep track and be careful with what we're doing and making some of these healthy decisions for ourselves and our community, and really making sure that we're not jumping the gun. So I know spring break's coming up for some of our local K-12s. If you're going to travel over spring break, be really careful, take those precautions that you need to make sure we're not spreading it, so that we can get to this point in the summertime where things are opened up a little bit more and more safely.
Okay. We're going to move on and again bring back in our Vice President, Wayne Gersey, for diversity inclusion. So Wayne, I will turn it over to you for your brief update here. Go ahead, Wayne.
Thank you, Steve. So I'll begin. It was early in 2020, not long after the pandemic hit our shores, when researchers first began reporting COVID-19 rates disproportionately affecting certain populations. So some of the many inequities in social determinants of health that generally put those in poverty, racial, ethnic, and minority groups, the elderly, the unable, as examples at increased risk for health issues, including further increased risk for COVID. So simply put, conditions in places where people live, learn, work, play, and worship affect a wide range of health risks and outcomes. This includes COVID-19 infection, severe risk, and death as a result of the virus. These conditions are known as social determinants of health. Long-standing systemic health and social inequities have put many people in marginalized and most vulnerable groups at increased risk of contracting COVID-19, as well as dying from the virus. So let's consider some of the factors that contribute to increased risk. Some of these factors include being uninsured, so lack of consistent quality healthcare means more likely to have medical conditions such as diabetes or heart disease that put one at a higher risk for severe illness or death from COVID-19. Lack of personal transportation. So if you rely on public transportation where risk of transmission is greater, lack of transportation results in lack of access. Communication and language barriers are also a risk factor. Lack of childcare, inability to afford to take time off of work. Occupation, so working in a setting that presents more exposure. So service industries, corrections, where nationally these jobs are disproportionately performed by people of color. House crowding conditions, multi-generational households, challenging to follow prevention strategies. That's what one of the outcomes is in living in house crowding conditions. Education, income, and wealth gaps. So these are some of the factors, along with others, that are associated with more COVID-19 cases, hospitalizations, and death. So in Michigan, Here in Michigan, the Coronavirus Task Force on Racial Disparities reported that the COVID-19 pandemic had disproportionately impacted communities of color in Michigan. As an example, African Americans represented nearly 14% of the state's population, yet they represent 40% of the deaths from coronavirus. A CDC study showed in 2020 overall, Hispanic people under the age of 25 were about 1.55 times more likely than young white people to have COVID-19, while young Indigenous Americans were about 1.7 times more likely, and Native Hawaiian and Pacific Islanders were 2.3 times more likely to get the disease. We also need to reflect on the degree to which the pandemic has disproportionately impacted women. In 2020, after shelter-in-place orders went into effect in the spring, schools quickly went to remote learning. What happens next was predictable. As things shut down, women were primarily made responsible for the bulk of childcare and learning needs. Parents were being put in very challenging situations, and it derailed entire careers, especially for moms. Since the pandemic, women's jobs have been almost twice as vulnerable as those of men, and women spend twice as much time caregiving as do men. A job report mid-pandemic, so in September of 2020, showed 1.1 million people left the workforce. The vast majority, about 865,000 of those people were women. Aside from issues in the workplace, there's reason to be concerned about the high rates of domestic violence. While how much domestic violence may have increased with shelter-in-place or lockdown orders is unclear. A 20% increase based on volumes to call centers seems to be a conservative estimate. Women's experiences of this pandemic are for certain dissimilar to that of men. COVID-19 also poses unique challenges for people with disabilities. The COVID-19 pandemic has disrupted many aspects of our daily lives, but impacts are especially acute for people living with disabilities. They may struggle with challenges like finding reliable and safe in-home care. Social distancing is not always part of that option. Physically adapting to enhanced hand washing, guidance, and other issues for some. Communication may be a barrier. Getting information can be more difficult for people with vision, hearing, and even cognitive disability, as popular news sources may not be accessible. Unsurprisingly, the disparities not only seen in COVID rates, hospitalizations, and death. We are now seeing the same inequities in vaccination rates. The CDC reports disparities in COVID-19 vaccines have been seen in the majority of states. So these same factors that shape the disproportionate impact of COVID on these populations are again shaping the vaccination rates. Consider some of the factors I shared earlier. Many people struggling to make ends meet are working multiple jobs, which make it difficult to get time off. If you're poor or if you live in a rural area, you're likely to have to travel far to get the vaccine, spend hours waiting, and that definitely has an impact on one's livelihood. Again, maybe you don't even have the transportation to get yourself to a vaccine. So stark disparities in vaccination rates were recently reported, for example, by the Boston Herald. In a Boston neighborhood where Latinx were 82% of the population, 3% of the Latinx residents had received at least one vaccine dose, compared to 55% of the white residents who had been vaccinated, but who were only 12% of that city's population. In another, which is Black, 53% was Black, 16% of the Black residents had received at least one dose, compared to 40% of the white residents, who are at 23% of the population. There are many more groups we know which have been disparately impacted: those in prison, refugees, Indigenous Americans living on reservations, and we don't have time to touch on all of them. But we need to learn from this crisis and recognize COVID-19 revealed yet another reason that addressing the social issues related to equity are vital. We need programs and practices that fit communities where people live, learn, work, play, and worship. Ensuring fair access to quality, affordable programs and services for education, housing, transportation, childcare, healthcare, and more will improve opportunities in our country and ensure that all communities can thrive.
Great, thank you, Wayne, for the update. Couple of questions here to start, and I just want to remind our audience, if you do have a question, there's a couple different ways. If you're on the Zoom webinar, you can use the Q&A button at the bottom. If you're out there listening to us or on social media, you can email questions to townhall2020@mtu.edu. So a couple of questions, Wayne, to get started. Certainly, it seems like the COVID-19 pandemic has exposed and exacerbated these inequalities and disparities in the United States and even across the world. Compared to other natural disasters, other crises that have occurred, Hurricane Katrina, for example, the Great Recession of 2008, is this unexpected, or is this expected that when we have something like this, we're really seeing the ramifications of these inequalities and disparities?
It's not surprising. I think I like to talk about it from a workforce preparation perspective. If we have a workforce that's reflective of our population, that addresses the demographic needs that are current or that are pending, in terms of who are the decision makers that set policy, who are the decision makers that create interventions. If those groups are representative, then the consideration for those who are what we call for marginalized groups, accounting for their needs would occur. But if we have monolithic populations in those who make decisions and those who provide care when who make decisions when these things happen, then some folks are going to be left out. So I think it's imperative that we therefore are focused on, one, making sure that we prepare a workforce, a next generation workforce that's diverse, but also if they're not diverse, that they're able to be culture responsive or culturally proficient to the needs of those who they serve. Just like they need to be technically proficient, we also need to be culturally proficient in providing cares to the communities we're entrusted to take care of.
Okay. I'm going to go to one more question here, and I'm open this up to both Wayne and Kelly too. Feel free to add. This question is from here on our Zoom webinar, asking where's the best place to find COVID-19 related disparity data?
I'd like to turn it over to Kelly, give her a first shot at it. I certainly have some thoughts.
Sure. So there's really good data both on the CDC website, and State of Michigan does some good data that looks at racial and age differences for COVID-19 deaths and hospitalizations, as well as infections. Other disparities, you may need to delve into some information from other organizations that would address specifically things like the effect on differently abled people or gender differences. And CDC also will have information within our Indigenous populations. And I just had one other and I totally forgot what it was.
Great, thanks, Kelly. Wayne, was there anything else that, I know you presented a lot of data here.
Yeah, so my data is primarily from the sources that Kelly cited, the CDC, and then also the Michigan, the Corona Task Force on Racial Disparities is where I got a lot of my data from. So I'm sure NIH, as studies come out, will have additional data sources to report on this, and American Medical Association as well.
Okay, great, thank you. We're going to go ahead and move on to our next presenter, and I'll have her go ahead and unmute as a quality control check here. Welcome in Angela Hoffman Cooper. Angela, great to see you again. Angela is an educator here in the Pavlis Honors College at Michigan Tech University. She also has a dual role as the executive director for the Association for the Assessment of Learning in Higher Ed. So Angela, thanks for being here, and tell us a little bit more about the topic you're covering tonight on foster care and disparities.
Thank you so much. I'm really grateful to be here, and I'm especially grateful for the framing of Vice President Wayne Gersey earlier around disparities. I think young people with experience in foster care are often a population that is hidden in the conversation around disparities as a hidden sort of identity, hidden experience, and also do experience a lot of intersecting identities that were talked about previously. So in terms of young people that experience foster care, there's an overrepresentation of African-American young people. There's an overrepresentation of LGBTQ youth, as well as youth who have disabilities or different abilities. And so we start seeing some of these disparities start compounding when we start looking at what Kelly was talking about earlier with some of those obstacles. So young people with experience in foster care do oftentimes experience some limited aspects of power or having their voice maybe minimized as the system is making some decisions for them. And there is a general assumption sort of in society overall that folks have the support of a stable family structure. And that carries with them oftentimes when they go to college. Now, we oftentimes know and experience that that's not true for many of our young people, for many of our students, not just for young people that have experienced foster care, but certainly it is increasing likelihood among that population. And so I appreciate being invited to share a little bit about some of that impact. So to provide some context on foster care in the state of Michigan, there's about 13,000 young people in foster care in the state of Michigan. Across the nation, there's over about 400,000 youth in foster care. Any given point in time, over the course of an entire year, usually about 600,000 youth are in care at some point. So we're talking about a really large number of youth potentially being impacted by this. And then there's the added layer of youth who are not reunited with their biological parents or their family of origin, or adopted out of foster care. Those folks that don't have an established sort of formalized permanent family connection age out of foster care when they reach sometimes usually between the age of 18 and 21, depending on their circumstances. And so in Michigan, each year about 1,000 young people age out of foster care without some of those permanent sources of support and resources. Across the nation, that number is about 20,000. So if we're looking at the larger population of young people ages 18 to 24, there's about 100,000 young people out there across the nation who have aged out of foster care and don't have some of those stable connections that really can cause some challenges in accessing education, experiencing homelessness, getting access to healthcare, all of those pieces. And so I will share that in last March, when the pandemic first began, I was thinking personally about what the pandemic would have meant for me had it occurred during my youth when I was in foster care, or when I aged out of foster care when I turned 18 and came to college at Michigan Tech. And so I have been working with several associations and organizations that serve this population, and unfortunately have witnessed a lot of the concerns that came to my mind actually playing out since the pandemic began. So in terms of some information that's been gathered from some of these national organizations, for young people who have aged out of foster care, about 65% did lose their unemployment. 50% were unable to get unemployment because of their employment sort of situations or inability to sort of get connected with resources. Others had their hours cut or were temporarily laid off. 52% did not receive the stimulus. I know we have a question in the chat about homeless population receiving the stimulus. And so again, for folks that maybe don't fill out their taxes, don't have a stable address, there can be challenges to getting that stimulus check. So those are some of the challenges that this population has been facing, particularly those that are aging out. This is in addition to a broken educational pipeline for this population. So although 70% of young people with experience in foster care want to go to college, only about 50% are graduating from high school, about 20% are enrolling in college, and only about 3% are graduating with a bachelor's degree. Now, 20% are going to college. So these are students that are on our college campuses. So when campuses shut down across the nation, that posed a challenge for many, many young people of where to go when you don't have that backup plan, that family safety net. Fortunately, some of our local institutions, Michigan Tech, had a system in place for keeping some rooms open, keeping some halls open, offering students the option to stay still on campus. But those are definitely nationwide concerns that did come up, and not everyone had the options that our community fortunately does provide. I also want to share some of the things for young people that are in foster care and maybe aren't young adults yet. The impact of the pandemic certainly impacted the amount of contact young people had with mandatory reporters in terms of school teachers and counselors and administrators, folks that could help keep them potentially safe if their home environment was not safe. And so we have some young people that are potentially continuing to live in unsafe situations, and that's not being brought to the forefront because they're not in an in-person school environment. Certainly food insecurity gets to be a challenge when young people are counting on those meals, maybe provided by free or reduced lunch for those that are in care or with biological family of origin. I will also share that I've heard there's fewer families registering to become licensed foster parents, or those that are licensed foster parents are taking fewer placements during this time out of concern for pandemic spread. And so that makes it even harder for these young people to find some of those stable living situations. Some youth are also lingering in care longer than they may need to. There was a time certainly where court hearings were delayed, reunification with biological families was delayed, or visitation with families. Now, some of that has been resolved with time. Court systems and caseworkers have become increasingly agile with offering virtual visits, with offering virtual court hearings or distanced court hearings. So we are starting to see some improvement with time, but there certainly have been challenges to get to this point. Young people with experience in care, I mentioned, also oftentimes have struggles with learning disabilities or trauma. And so being in a virtual learning environment can be really detrimental to getting support identified for some of those needs. When a young person enters into care, if they're not having that more direct interaction in the school environment, they may not be getting support for some of those things identified early on. So we're going to start seeing potentially some trickle effect of now we're a year into the pandemic, and maybe just now some of these needs are being identified. I will share that there has been some improvement. So there is a congressional caucus on foster youth, the bipartisan group that has passed and put forward some legislation. So there's now federal guidance to support youth aging out of foster care ages 18 to 21, actually allowing them to re-enter foster care during this time. And they have some agency in deciding, is that going back in and being placed with a foster family, or do they enter into sort of an independent living situation where they still have access to some resources, case management support, some financial support, education vouchers, but within their own space where they're living. For those that are interested in also considering being a foster parent, would encourage you to connect with local UP kids. As I mentioned, there certainly is demand. And then also, mentoring is still needed during this time. Virtual mentoring is still an option, making connections with young people, and that can really be a big help for youth of all ages.
Thank you so much, Angela. I'm going to start with a question here. In previous town halls, we've talked about K-12 students in general falling behind during the pandemic. Where do we even begin to start to assess learning in our foster youth and where they stand, and how can we help them moving forward?
That's a great question, and a really complex question, because I think that it's a question that has been asked pre-pandemic and just becomes all the more important in the midst of the pandemic. And so fortunately, many of our local schools do have great systems in place, many of the schools across the state and the nation, for identifying some of the sort of what are the skills students are coming in with, what is their level of readiness, and how to continue to support them. And there are certainly several disparities. There's several pieces of research that show that it's not a secret that young people with experience in care do experience discrimination within the education system and are ruled out of a lot of college preparatory classes and tracks and mentoring, and are oftentimes overdiagnosed with things like learning disabilities. And so I think continued training can certainly be helpful around the needs of this population. How does trauma show up in the classroom, and what does trauma-informed education look like? all the time and in the midst of a pandemic. And I think about trauma-informed education for all of our young people that are living through this pandemic, and not just young people with experience in foster care. So those are a few of my thoughts of sort of where we might start in addressing this challenge.
Angela, you talked a little bit about if folks want to check out UP Kids, get involved with mentoring. Could you speak a little bit more on the importance of mentorship in general for foster youth, and now in particular during the pandemic?
Absolutely. Gosh, there's so many statistics out there from so many different surveys of when young people are asked, do you feel like you have someone you can count on? That the answer is no. Or do you feel like you have enough people you can count on? That the answer is no. And that's not the answer that we want young people to have, our next generation of leaders to have. And so that's really where that mentoring comes in. There's a lot of research that also shows the difference that a supportive adult can make in a young person's life, whether that's a career connection or just social emotional support. I know I'm incredibly grateful to have mentoring relationships with a number of young people, some of whom have experienced time in foster care. And I'll just share, having run a mentoring program before and receiving this feedback as well, it's such a mutually reinforcing and beneficial experience to share and give of your time in that way. So if you're thinking about it, just do it. Sign up and be a mentor and get connected with someone that you could really have a huge impact on, but also be prepared to be changed yourself.
And Angela, the website, where can folks go specifically if they would like to sign up or get more involved?
Oh, that's a great question. It would be the UP Kids website. So I'm going to pull that up here real quick, upkids.com. Okay. And from there, you can get connected to foster care specific resources in terms of, considering becoming a licensed foster parent, or also their mentoring programs, Big Brother, Big Sister, things like that.
Fantastic. Thanks, Angela. We're going to pause here just for a minute. I'm going to recognize our sponsors. We're here for our COVID-19 Community Town Hall. I want to welcome any radio listeners that might be tuning in. If you'd like to see some of our visual content, if you go over to thewolf.com, you can click on the links to join us on the Zoom webinar or on Facebook Live. Our town hall is focused on health disparities, as I mentioned. Our presenting series sponsor is UP Health System Portage. Our supporting sponsors include the MTech Smart Zone, Upper Peninsula Power Company, the Physiological Society, Aspirus, along with their Iron Area Health Foundation. We're going to continue on and welcome in our next speaker. I'll go ahead and ask her to unmute to give her a few seconds here. But it's a pleasure to welcome in Kathy Cass-Ayton, who is the Executive Director here at Little Brothers in the Houghton Hancock area. So Kathy, great to have you with us. And tell us a little bit more about our older population and isolation during the pandemic. I'll turn it over to you. Thank you.
Great. Thank you for having me. It's such an honor to be here. And I guess quickly to tell you about Little Brothers. Little Brothers Friends of the Elderly is a volunteer-based organization that provides friendship and service to elderly people. And our local chapter serves 5 counties here in the Northwestern UP. And we focus on elderly people who are alone, who are isolated, or who identify as being lonely. And all of our services are really geared with the whole goal that we relieve that isolation and loneliness that people feel. And I think it's important to note that the people that we deal with, isolation isn't new to them. I'm not saying they're not affected by the pandemic, but I do want to point out that this is something that they have dealt with. And that's why Little Brothers is involved with them. And so just to talk a little bit about the services that we provide, we have 7 core programs that we provide locally. And some of those programs vary a little bit from county to county, but we have our some direct services. We have a medical transportation program. So we bring people to doctor appointments. We have a food pantry. We give food out every month to between 90 and 100 elderly friends. We have a loan closet of medical assistive devices that are donated and then given out. It seems like every day that we're giving items out to people. We also have our holiday celebrations that we do on Thanksgiving, Christmas, and Easter. So coming up on Easter Sunday, we'll be delivering home delivered meals to our elderly friends. We normally celebrate small activities all year. In a normal year, we would have between 50 and 60 small activities that we would bring people out to, just to any excuse to celebrate or get together and socialize with one another. And obviously we can't do that in the same way. So we've shifted through this past year to try and do some creative virtual activities. And we've had some success with that. And then really the heart and soul of Little Brothers, what we're all about is visiting and providing that friendship and companionship. And this is something that is definitely, we haven't been able to visit people in their own homes or in their living environment for really the past year. And that's been, I think, really challenging and very difficult for all of us, including our elderly friends, our volunteers, and our staff, because, you know, these are our friends. And I think we're all feeling that isolation, but we've really been in a lot of, we've had a lot of phone contact with our elderly friends, calling them all the time. And also we do a lot of mail, a lot of friendship mail to keep engaged with our elderly friends. And I want to talk a little bit about how the pandemic has affected our elderly friends. And I have kind of two experiences to pull from. So on one hand, we have our staff and our visiting volunteers who have really close relationships with one or more elderly friends. And we talk to our elderly friends all the time. And then we have another pool of data that it was collected last spring, actually, when the pandemic first started. We had several classes from Finlandia who did wellness calls to a broader group of elders. And this was really great. These were people, elders that we didn't know a lot about, knew a little bit, and we had the students call them and talk to them. And really the goal was to assess their situation and find out if they had unmet needs or if they had any concerns. Do they have people in their lives that they have contact with? So they had very specific questions that they asked. And I would say there are a couple trends that are similar, really, from both groups of people. The first thing I will tell you is that the elderly people we work with are really so resilient and really pretty amazing, especially in the beginning. For the people that we're close to, we found that our elderly friends were worried about us, that they really wanted to, I mean, and that's what a true friendship is, right? I mean, they just wanted us to be healthy. And they certainly, some of them kind of went with the flow of this, you know, they're just going to ride it out. They're going to see how it goes. Then there were others who were very fearful about getting sick themselves or us getting sick because, you know, again, we're friends, but also they know that we're somebody that they can count on. And so there's definitely been fear about either them getting sick or us getting sick. And it's been really an interesting experience, I would say. I will tell you that the people who seem to have either underlying health conditions or maybe experienced recent losses in their lives, lost a loved one or a pet, or struggle with anxiety or depression, or have loved ones in nursing homes, those are the group of people that have just been really hit so hard with this pandemic. And that's something that we see and we hear every day. And that's really been a struggle. And, you know, as much as the phone connections provide something, I mean, they're better than nothing, but it's just not the same as visiting in person. So we're all looking forward to that day when when we can do that and when we can have our social gatherings again. And just, I guess, a couple things that I picked out of the data that the groups collected from doing the phone calls. It looked like it was pretty consistent with all the calls that probably a quarter of the people have been struggling with anxiety or depression. And it was really, it really touches your heartstrings when you read some of the comments about, I wish it was over. My husband is in a nursing home and I can't see him, and it's very difficult to deal with. I'm worried about my stimulus check coming. So just all of those things that really add to the worry that people have. But on a positive note, it's been really refreshing to have the positive attitude, the people who say things like, I wish there was something I could do to help. So it's been a trying year for sure.
Kathy, can you elaborate on what can we do to help?
We are always looking for people who want to have more contact with an elderly friend. And I would say even reach out to your neighbor or your family members, that phone contact, that even, I'm going to the store. Would you like me to, is there anything you need? Is there just remembering special occasions, a birthday, anniversary, or just any reason to send a card? The more contact we have with one another, the better. And we certainly at Little Brothers have lots of opportunities if people want to volunteer for Little Brothers. But even if you do things even within your own community that you live in or your neighborhood, reaching out to those around you makes a huge impact.
I want to bring Kelly in here for a minute. Kelly, if you'll go ahead and unmute yourself. I think there's a very related question that came in the Q&A box here a little bit earlier. Can you help us bring that question to light here, maybe for Kathy, and also any input from our other panelists?
Sure. Well, I think what the question that had come in, it strikes me that it affects really all of our panelists, because it's asking about those populations and the groups within our communities that are invisible. And I think that's really the crux of what is affecting these disparities, are that these populations are invisible to the populations that have the power and have that voice, and the importance of bringing a voice to these individuals. And I would just like to hear from each of you. It's not quite the question that's being asked, but what can we do to help bring these populations, to help give them a voice in their lives in this pandemic, as well as in all of these things that are affecting, and I think everybody's addressed that, is that these disparities are being brought forth and they are directly affected from COVID, but they're also just bringing forth these disparities that already existed and we already should be dealing with. So if each of you can kind of speak to what we might be able to do as individuals, or for advocates and allies to try and help bring out the voices of these individuals. And we'll start with Kathy.
Sure. I think that's an excellent question. And it really brings up the whole point that through the pandemic, one issue is the people who we don't know about, who are isolated, and maybe they don't have the resources, they don't know who to reach out to, but we also don't know about them. And so I would say for anybody, if you have anybody you wonder about, reach out to them, because there is, I think, a whole group of for us, I'm sure, a whole group of elderly people that we are not aware of, and the pandemic has made them more isolated and not available to us. So it's really being proactive and not assuming that people have connections or are cared for. It's really being proactive.
Thank you. Angela, could you speak to your populations you were speaking about?
Absolutely, yes. I really think Kathy hit it home there with saying not assuming that folks are cared for, that they have connections. And so I think that is absolutely applicable to young people with experience in foster care, youth who are in foster care, young adults who have aged out of foster care. I also think about, Kelly, you talked about for folks that are in positions of power, folks that are pulling data, folks that have the ability to tell stories and share data. I think data talks. And so for those that are sharing data around COVID-19, thinking about the populations that you are including in those sharing of data and what populations you're excluding, and also what narratives, because I think stories matter too, individual stories, what stories are being shared, whose story is being missed, and at what intersections. I think that those things are all incredibly important. And I would also just encourage thinking about what are the assumptions. So I think about all of the colleges, not like Michigan Tech, that closed down their entire campuses and left young people with experience in care with nowhere to go, no secure internet connection to continue their schoolwork, creating academic challenges for them down the road, impacting their ability to graduate, impacting their financial stability for students that rely on financial aid for their well-being. I mean, it's this huge ripple effect, and I'm guessing that that was not the intention of those campuses. The intention was, let's shut down, let's keep our campus safe, get folks back where they can sort of isolate, forgetting that perhaps not everyone's able to safely isolate, has a space to go back to isolate. So just being aware of our assumptions, I think, is incredibly important.
Thank you. Dr. Gersey?
Yeah, thank you, both Kathy and Angela. That was very comprehensive. What I would add to that, at our core, we need to constantly ask these questions when we make decisions. What are we missing and who are we missing? We have to get outside of our bubbles and lean into this comfort of recognizing that our privileges might not be the same for others. I think it's the right question to ask, even when you have come to a decision, and look around and figure out who's not represented. Because those voices tend to not have a voice. So you're the voice for them. So I think it's important that we lead with those questions before we hit send, or before we make an announcement. And I think some of the stuff that Kathy and Angela talk about, if we ask those questions, those things will be addressed.
Thank you to our presenters for, and Kelly, for your help with that question. A couple of things came in at the chat there at the same time. I want to ask a question, open up to the panel here, talking about internet accessibility. And I think this applies to everybody here, whether it's older adults, whether it's foster youth, Michigan Tech students here living in rural and urban areas, and Kelly, even when folks are trying to access public health information. So could we go around the panel here and just talk about what do you see as the major hurdle, and then moving forward, how would this help us if we had better accessibility across all of the different groups? Angela, maybe we can start with you. We'll go in a little bit different order here.
Sure. I think internet is absolutely a hurdle for many young people with experience in care. Again, one of those things that exists as a hurdle pre-pandemic. I grew up in a home that didn't have internet most of the time. And so that had an impact on my ability to do high school homework. And this was, gosh, however many years ago. The assumption of internet is so much more core to our sort of Maslow's hierarchy of meeting our basic needs now today. And so I think that is an impact and a concern for many young people, particularly, again, when campuses shut down or having to sit in vehicles. And again, foster care or not, having to sit in vehicles outside of the McDonald's to plug into the Wi-Fi, having to sit in a vehicle outside of the campus library, things like that, driving from rural areas, 20 minutes to go find that internet connection, potentially being in unsafe situations trying to do that. So those are definitely challenges. And I think some ways to solve that would be, increased connectivity options, increased connectivity locations to do that in communal ways, but in safe and socially distanced ways now in the midst of the pandemic. But again, how can we sort of address this problem now, but also address it for the longer term too? How can we take our learning from this moment forward?
Thanks, Angela. Dr. Gersey, did you have anything to add?
Yeah, the digital divide is real, and it's unfortunately the groups that we're talking about here are overrepresented. Even technology And my mother won't touch a computer. Okay, so how do we get information to her? Many elderly who live alone. So it's not just about internet, but it's multiple ways of engaging. And you know, I think much of this work is relationship building. It's not transactional for those who are the end users of this. So we need to think internet, we need to recognize the digital divide, but we need to also think about other ways that some folks are more comfortable interacting and communicating across. So I think that's a challenge, but certainly the digital divide is real. And I think Angela addressed it beautifully.
Thank you. That's a nice segue. Kathy, did you have any perspective that you wanted to provide?
Yes, I really appreciate what Dr. Gersey said, because for our older population, most of them are not used to using the internet or don't have access to it. And they're spread out all over. A lot of them would not have probably good access at this point. So I think those are things to strive for. I guess a lot of our people, it would open up so many new doors for them to be able to have access and to learn how to get information and research and have access to the internet. But at least the group we work with now, they're not people who have been relying on internet and are now struggling. So that's a good point, but it's definitely, I think, a huge issue throughout the UP.
If I may add something, like before the internet, we had shortwave, we had AM radio. So, you know, where I come from, I grew up in South America, in a third world country, and to make sure that people had access to information. Communities, the government would hand out shortwave radios, pocket radios, we used to call them back then. So these are other ways. So we have to think differently about how people get their information and where they get their information. And it's not just, hey, let's lay broadband, but for those who still might not be left, that might be left out. Some other strategies might be pocket radios, or making sure that information is disseminated across those channels where those folks might get their information from.
Thank you, Dr. Gersey. Kelly, I'm going to give you, just for the sake of time, wrap up here. I'm going to give you the final word. We have about 20 seconds here before I wrap up with some final announcements for the community. So what do you have for us?
Well, I'd just like to say that I think we have to think about this digital divide with getting vaccinations. So the fact that many areas are only required, the only way you can get on a list is by getting online. And who are we leaving out and who are we missing for that next critical step by not having easy access in all these different ways, like everybody has suggested.
Kelly, can you remind our listeners and our viewers again that important date coming up, April 5th, in case they missed it in the beginning?
So April 5th in Michigan, everybody who is 16 and older is eligible to get signed up to get in line to get your vaccination. You won't get it that day, but you can sign up and get in line. Contact your local health department, your healthcare provider, or your local pharmacy to find out where you can get the shot.
Okay. Well, thank you so much to Kelly, and importantly to all of our presenters. Just want to acknowledge them for all the work that you're doing and taking the opportunity to come in to our town hall platform here and better inform our community. Thank you to Vice President Wayne Gersey for diversity inclusion, Angela Hoffman-Cooper, and Kathy Cass-Ayton. I want to thank our sponsors, again, the Health Research Institute for organizing these, the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, along with their Iron Area Health Foundation, the Physiological Society, and once again, our presenting series sponsor, UP Health System Portage. We will be back on April 29th. That'll be our final town hall of the spring semester here on our campus. That topic will focus on how the COVID-19 pandemic is impacting the environment and climate. So a new topic that we'll cover, so stay tuned for that. Remember, if you missed any part of the broadcast, or let others know who might not have internet, that will be on ABC 10 in Marquette, 12 p.m. Eastern this Sunday, a rebroadcast. So until then, stay healthy and safe and have a good rest of your evening.